So this is Karen. She's in her early 50s, and Karen's main area of concern was the fact she was losing volume in the mid-cheek, and this was leading her to look rather tired and drawn.
I decided to have dermal fillers because each time I looked in the mirror I felt I looked tired and drawn, and a lot of people, particularly my children, were always asking me if I felt tired or if I was unwell.
I quickly established the reason for this was because she'd actually lost volume through her cheek area. By losing volume in the cheek area often means that it accentuates that line that sometimes appears under the eye. We call this the tear trough. If you lose volume in the mid-cheek area, it really does accentuate the tear trough as well. In our clinic, we always use hyaluronic acid fillers. They're extremely well tolerated, have a magnificent safety profile. They're also very hydrating because we know that hyaluronic acid is extremely water loving, so it will draw in water from other areas and really plump the skin out. We only ever want to replace lost volume. We never try to put in more than was there in the first place. This is when we start getting that distorted look, cheeks that are too big and lips that are too big. By only ever going for what was there in the first place, you get a much more natural look.
Since having the treatment, I feel so much better in myself, so much more self-confident, happy to look in the mirror when I put makeup on, and people have commented on how well I look and how fresh my skin looks. Luckily my children haven't even once commented on how tired I look since having the treatment.
The tear trough is a really difficult area to fill, and you must always go for a less is more approach. You can always top it up at a later date, but by doing this you'll end up with a much more natural and smooth look to the under eye area. We generally like to see our patients 2 weeks after the initial filler treatment because there tends to be a little bit of swelling immediately after the treatment. This is very normal and it's often fairly minimal, but by allowing for some swelling and then reviewing 2 weeks later, we can get a really natural look.
I'd definitely go back for dermal fillers again. The results were immediate and they last for over a year, and my skin looks so much better. I'm really, really pleased.